Would you believe that nearly 1 in 3 heart attacks begin without the crushing chest pain we've all been taught to fear? No gasping, no collapse, no dramatic clutching of the chest like we've seen in movies. Just a quiet unease, a mild fatigue, a strange breathlessness after walking across the room, and sometimes nothing at all. That silence is what makes it dangerous, especially if you're over 60, like so many of us, and you've chalked these small changes up to just getting older. We tell ourselves it's normal to feel tired. We blame that dull ache in our back on sleeping wrong. We wave away indigestion after dinner, yet we keep pushing, dismissing, delaying, because we think if it's not severe, it can't be serious. But what if it is? What if that small whisper in your body was your heart's early cry for help? And what if ignoring it, even once, cost you your chance to act in time? Today, we're peeling back the curtain on the real early warning signs of a heart attack. The subtle, unexpected, and too often ignored symptoms that could appear weeks before a major cardiac event. You won't just hear what they are. You'll learn why they matter, how they work, and most importantly, what to do when they show up. Because knowledge here is life-saving. So if you've ever felt off, even if you couldn't quite explain it, stay with me. This may be the most important 15 minutes you'll spend this year. Don't let a silent symptom steal your tomorrow. It's easy to think of a heart attack as something that strikes suddenly, like a bolt of lightning on a clear day. 1 minute you're fine, the next you're in crisis. But that's not how it works. The truth is, most heart attacks are the final chapter in a story that's been unfolding quietly, often for decades. It begins with a slow, silent process inside your arteries, something called atherosclerosis. Over time, fatty deposits, or plaques, begin to build up along the walls of your arteries. They don't cause pain, they don't cause symptoms, but they do one thing relentlessly. They narrow the passageways your heart relies on to receive blood and oxygen. Now here's where it gets dangerous. As those arteries tighten, your heart must work harder just to do its job. And because the process is so gradual, your body adapts. You might feel a little more tired after walking. You might slow down a bit when climbing stairs. But you tell yourself it's nothing. And in doing so, you miss the critical window. Because in many cases, long before a full-blown heart attack hits, your body does try to warn you. In a groundbreaking study published by the National Institutes of Health, researchers found that more than 70% of women who suffered a heart attack had experienced unusual fatigue weeks before the event. Not pain, not pressure, fatigue, just feeling drained in a way that didn't match their usual day. This is the real story of how heart attacks begin, not with a bang, but with a whisper. And if we can learn to hear that whisper, we can change everything. We can catch the signs earlier. We can intervene sooner. We can protect more lives. So no, a heart attack doesn't happen overnight. It's a slow erosion of your body's warning systems, and a test of whether you're willing to listen before it's too late. There's a phrase doctors use that might sound simple, but it carries a life-saving truth. Time is muscle. What does that mean? It means that during a heart attack, every minute your heart doesn't get enough oxygen, more of your heart muscle begins to die. And the longer you wait, the greater the damage. Think of your heart like an engine. When the fuel line is blocked, even partially, the engine starts to sputter. But if you ignore the warning signs and keep pushing forward, eventually it stops. And unlike an engine, your heart can't just be replaced with a trip to the mechanic. Now here's the good news. When early warning signs are recognized and acted upon quickly, the heart can often be saved, or at least protected from serious long-term harm. Studies show that patients who receive treatment within the first hour of symptom onset have dramatically better outcomes. Some recover fully. Many avoid invasive procedures. Most return to their normal lives. But that outcome depends entirely on one thing: how fast you respond. So instead of brushing off that strange pressure in your chest or that wave of dizziness as just aging or just stress, stop and ask, could this be my heart asking for help? Because if it is, and if you act quickly, you're not just buying time, you're saving muscle, you're preserving strength, you're giving yourself the best possible chance to live fully, vibrantly, and well. Time is muscle, and time is yours to protect if you choose to act. Let's talk about the signs most people miss. They're not dramatic, they don't scream emergency, but they matter deeply because these are the soft-spoken clues your body might be dropping days, even weeks before a heart attack. If you're over 60, these aren't just symptoms, they're signals, and recognizing them could save your life. 1. Unusual fatigue that just doesn't make sense. This isn't the kind of tired you feel after gardening or walking the dog. It's deeper. It lingers. And no matter how much you rest, you still wake up exhausted. Many seniors chalk it up to age or poor sleep. But according to a major study from the National Institutes of Health, over 70% of women who experienced a heart attack reported profound fatigue in the days and weeks leading up to it. And it's not just women. Men experience it too, but they're less likely to mention it or even notice it until it becomes disabling. Imagine you're someone who used to enjoy daily walks, and now you find yourself stopping halfway, legs heavy, breath short, or maybe you start skipping chores that once felt easy. That's not just getting older. That could be your heart struggling to keep up. 2. Shortness of breath, especially when lying down. Ever feel like you can't quite catch your breath while climbing stairs, or even while resting? Or have you noticed that you need an extra pillow to sleep because breathing flat feels uncomfortable? That's not just lung trouble. It can be a subtle sign of your heart not pumping efficiently. When the heart weakens, fluid can start to back up into the lungs. This mild congestion is sometimes so gradual, you might not even notice it at first. But when your lungs are full of fluid, it's harder to pull in oxygen. That's why shortness of breath can be one of the earliest red flags. If you find yourself winded doing something that used to feel effortless, it's time to listen. 3. Nausea, indigestion, or stomach discomfort. Here's one that really throws people off. You feel a little queasy, maybe bloated, maybe a dull ache in the upper stomach. So you reach for antacids or skip a meal, but what if that discomfort isn't coming from your stomach at all? The vagus nerve, which connects your heart, lungs, and digestive tract, can cause heart-related issues to feel like gastrointestinal ones. In fact, the American Heart Association notes that women often report nausea, indigestion, or vomiting as their primary symptom of a heart attack. That's right, not chest pain, but stomach trouble. If you experience these symptoms alongside fatigue or shortness of breath, don't ignore them, especially if they're new, persistent, or feel different from your usual digestive issues. 4. Dizziness or lightheadedness. That's hard to explain. We all get a little lightheaded now and then, when we stand up too fast or skip a meal. But what if that dizzy spell comes out of nowhere? What if it happens when you're sitting down or walking slowly? This could be a sign your heart isn't pumping enough blood to your brain. It might be due to a weak heartbeat or even a dangerous rhythm problem, something called an arrhythmia. Mrs. Eleanor, age 70, used to feel a little off balance only when getting out of bed. But over time, those spells started happening while she was seated, reading the paper. She brushed it off until her daughter noticed and insisted on a checkup. That decision likely saved her life. So ask yourself, is your dizziness new? Is it happening more often? Don't guess. Get it checked. 5. Anxiety or a sudden sense of dread. This one surprises many people. You might feel fine physically, but suddenly anxious, restless, or deeply uneasy. You can't point to a reason, but something in your body feels wrong. Some survivors describe it as a sense of doom or a gut feeling that something terrible is about to happen. It's not just in your head. Physiologically, this can be linked to your body releasing stress hormones in response to heart distress. Your brain picks up on those changes and tries to warn you in the only way it knows how. And yes, it can mimic a panic attack, but if it's not something you've experienced before, or it comes with any other symptom, like fatigue, nausea, or chest pressure, take it seriously. Let's recap these 5 symptoms don't always come all at once, and they don't always feel severe. That's what makes them easy to miss and deadly to ignore. But now you know what to watch for. Fatigue that won't lift, breath that falls short, stomach issues with no clear cause, dizzy spells that grow more frequent, a quiet voice inside saying something's not right. That voice? That's your heart talking. And if you listen closely, it just might save your life. Sometimes your heart doesn't follow the rules. It doesn't always send out pain in the chest or a dramatic collapse on the floor. Sometimes it speaks through the strange, the unexpected, the subtle. And if you're not paying attention, these signals can slip right past you. Let's explore 3 unusual, but incredibly important, symptoms that too many seniors ignore. 1. Cold sweats without a clear cause. You're sitting in a cool room, maybe reading the newspaper or watching TV. Suddenly you feel damp, clammy, almost as if you've broken out into a nervous sweat, even though you're not hot and you're not moving. That's not normal, and it's not harmless. Cold sweats are your body's stress response, triggered by the sympathetic nervous system, the same one that reacts when you're in danger. When your heart is struggling and not getting enough oxygen, this system kicks into overdrive. It's not just about sweat, it's about survival. Mr. Arthur, age 74, felt this exact sensation one quiet morning. He brushed it off, thinking it was just nerves or low blood sugar. But that cold sweat was his heart's way of saying, I'm in trouble. Days later, he had a major cardiac event. The warning had come, he just hadn't known what it meant. Now you do. 2. Chest discomfort that comes and goes. When people hear heart attack, they often imagine a sharp, sudden pain, like being stabbed in the chest. But in reality, heart-related chest discomfort is often mild, vague, or inconsistent. It might feel like pressure, tightness, a squeezing sensation, or even heartburn, and it may come and go, especially during activity or emotional stress. This is what doctors call angina, a warning sign that your heart isn't getting enough oxygen. There are 2 types: stable angina, which happens predictably with effort and eases with rest, and unstable angina, which can occur anytime, even while resting, and doesn't always go away with medication. That second kind is serious. It often means a heart attack is close. So if you feel discomfort in your chest that's new, more frequent, or different in intensity, even if it only lasts a minute, take note, write it down, talk to your doctor. Don't wait for it to get worse. 3. Pain in unexpected places. One of the most fascinating and dangerous things about the human body is how it can refer pain from one area to another. Your heart, for example, shares nerve pathways with other parts of your body. So when it's under distress, your brain might interpret the pain as coming from your arm, your neck, your jaw, or even your upper back. This is especially common in women and people with diabetes. Mrs. Helen, age 68, experienced a dull ache in her jaw that wouldn't go away. She thought it was dental, but paired with some fatigue and slight breathlessness, her daughter insisted she go in. That decision uncovered a serious heart blockage, one that might have taken her life if ignored. So remember, pain in your arm, shoulder, neck, back, or jaw, especially if it's new or unusual, deserves your attention. Don't wait for the classic signs. Because here's the truth. The classic heart attack doesn't happen to everyone. In fact, it's the exception more than the rule, especially for older adults. So don't wait for crushing chest pain. Don't wait until you collapse. And don't wait to lose someone you love before realizing these symptoms mattered. You have the knowledge now, and that means you have power. Here's the part that can make all the difference. We've talked about early signs, subtle whispers, quiet warnings. But what happens when those whispers become shouts? You need to know exactly when to stop wondering and start dialing 911. 1. Crushing chest pressure. That won't go away. This is the classic sign, and for good reason. If you feel a heavy pressure in the center of your chest, like an elephant sitting on it, and it lasts more than a few minutes or keeps coming back, this is an emergency. It may feel like squeezing, tightness, or even burning. It may spread to your arms, back, neck, or jaw, and it may come with cold sweats, nausea, or shortness of breath. If rest doesn't help, and you've been prescribed nitroglycerin, but it doesn't relieve the discomfort, don't wait. Call 911 immediately. 2. Sudden shortness of breath, fainting, or collapse. If breathing suddenly becomes difficult, much more than usual, especially at rest, or if you feel faint or actually pass out, this could mean your heart is failing to pump properly. Fainting, also called syncope, may be a sign of a life-threatening arrhythmia, an unstable rhythm that can stop the heart completely. Don't guess. Don't assume it'll pass. Call for help. 3. A gut feeling that something is deeply wrong. Many survivors say they just knew something was off. A deep, unshakable sense that something terrible was happening. Even when the pain wasn't severe, even when they couldn't quite describe it, trust that feeling. Because when it comes to your heart, it's far better to call and be wrong than to wait and be too late. Final reminder, never drive yourself during a suspected heart event. Emergency responders can begin treatment the moment they arrive, buying you precious minutes your heart may not have. So remember, crushing pressure, sudden breathlessness, fainting or collapse, a feeling of dread. That's when you call. No hesitation, no second guessing. Now that you know what to watch for, let's talk about what you can do. Because knowledge is powerful, but action is life-saving. Start a heart journal. It doesn't need to be fancy. Just a small notebook or a note on your phone. Each day, jot down how you're feeling, any symptoms, no matter how minor. Was there chest pressure, dizziness, shortness of breath after walking to the kitchen? Did you feel more tired than usual? Did you need extra pillows to sleep? Note the time, what you were doing, what made it better or worse. Over time, patterns can emerge, and those patterns are gold for your doctor. They help pinpoint problems before they turn into emergencies. Stay curious, stay honest, stay proactive. Don't downplay your symptoms. Don't wait for them to get bad enough. Speak up, ask questions, and remember, your doctor wants to hear from you. You are not a burden. You are not overreacting. You are advocating for your heart and your life. The best protection you have is your own awareness. Use it. Let's bring it all together. Your heart doesn't always shout. Sometimes it whispers. A quiet fatigue that feels out of place. A strange breathlessness while lying down. A cold sweat during a peaceful moment. A pressure in your chest that vanishes before you can name it. A gut feeling that something's just not right. These aren't inconveniences. They're clues. And now you know how to read them. You've learned how heart attacks can build silently over time. You've seen how fast action, not fear, is your greatest ally. You've uncovered the signs most people miss. And you've discovered how a simple habit like a daily journal, can become your early warning system. So don't keep this to yourself. If this message resonated with you, if you found even one insight that could protect your health or the health of someone you love, please share this video. It's not just content. It's a conversation that could save a life. And if you haven't already, subscribe to stay connected to more health wisdom designed with you, the over 60 community, in mind. Because every heartbeat matters, especially yours.